Thank you so much once again for joining us on this session. Moving on from my last session, which was cancers in women and breast cancer, and we had the starting session of ovarian cancer. Moving on to cancers in men. So we have, change. We have static. We have not seen much changes when it comes to prominent cancers in men. We have oral lip at the right, at the top. Then we have lung cancer. We have stomach cancer and other cancers also. We'll try and get on to all of them one by one. From starting the conversation, I want an overview from starting from Dr. Chaturvedi himself. Dr. Chaturvedi, tell me what is the current situation when it comes to cancers in men in India? What is the prevalence level? And what are some of the prominent cancer types that are coming out?
So, first of all, thank you for having us, and also thank you for Businessworld to think of oncology, because I think oncology is good business, but nevertheless it is very, very important for all of us. Because what we would say that the lifetime risk of getting cancer is almost 1 in 9. So it's a very, very major, significant health hazard. And I think it is very much required for the civil society also to engage into these conversations and take these practices into the society. As we were hearing in the first two sessions, that there's so much of preventable cancer and all those things. So I think it's good that you are doing it, and wherever we get a chance, we should participate in oncology-related events. It's for the larger good. As far as the overall scenario is concerned, the incidence is very close, men and women. It's about 51-49, you can say 50-50 for all practical purposes. The profile is very different. In women, breast cancer is taken over all other cancers, and cervical cancer and uterine is still there. As far as men are concerned, lung cancer is number one, and also it is one of the major causes for death. So it is not just the incidence, there's very little we are doing about it or not working enough to prevent it and things like that. Then you mentioned about the oral cancer or tobacco-related cancers. That is also very high on the list. So these are two cancers which are top 1 and 2 as far as men are concerned, but both are preventable. So I think that is one thing which I would say, that this is very important, that both these cancers are highly preventable and one should look at those aspects as well. Now overall, I think in the previous panel, somebody emphasized that in the year 1900, cancer was not there in US as top killer disease. In fact, we don't have to go that back. Even in 1970, in India, 50 years back, cancer was not there in top 10 causes for death. There were other diseases. And today it is competing with cardiac issues, and it will very soon take over the cardiac causes for death in next 5 years. So it is we are all heading towards almost like an epidemic for cancer. If you look at the developed countries, the incidence or the prevalence, the probability of getting cancer is almost 1 in 2 in the US. So it is, a lot is lifestyle, a lot was discussed, a lot is preventable, a lot can be detected early. So I think we need to focus on that also.
Right. But in the West, they have moved on from lung cancers being top to now testicular cancer or other cancers.
No. Lung is number one. Testicular is very low down, very low down. Testicular is not worth talking about because it is not the focus. And in areas where you cannot prevent, you cannot detect early, so there's no point in talking in civil society. Having an academic conversation is different. Treatment outcomes, all that is different. But I think for this audience and for the business world to focus on are areas where we can prevent, where we can early detection can help, and also how treatment is changing the outcomes. So there, for example, lung cancer, I think we'll discuss all that. I don't want to take away all that, but testicular is very low down.
Yeah. Dr. Sharma, your views.
As Dr. Harit Chaturvedi has very effectively expressed his views, that the number of cancers in men are more or less similar, that the incidence is more or less same, but the scenario is different. In men, because of their habit or because of their lifestyle, the more of that oral cavity, tongue, mouth, stomach, esophagus, lung cancer, these are more common associated. Second, prostate cancer and testicular cancers are exclusively in the men because they have that only. So, coming to the point that these are approximately mostly related to that tobacco use, and tobacco is the most important reason for developing them. Tobacco in both form, if you take in that smoke form, then it causes more of the lung cancer. If you take in that chewing form, then it causes more of the mouth and tongue cancer. And there is the field cancerization also, that if the cancer develops in the oral cavity, it may develop in that upper esophagus, stomach also, and in the lung also. So approximately 30% of the all cancers are usually related to the tobacco use, and approximately in all cancers, 70% of the cancers are usually preventable. So this is that scenario in current position.
Dr. Panda, we've talked about tobacco usage and how it, gets into cancer. So, but there was a recent study by a hospital which came out and said that, they looked at around 300 something cases where they studied them for a decade, and what came out was that 50% of cases of lung cancer were non-smokers. So what are your views on that? I don't know. I'm taking this. This is a separate study.
I've understood your question. See, we must understand that Professor Rana in a couple of sessions back said the commonest and the biggest risk factor of cancer is age. As cancer, as a machine become old, it degenerates. So our body, when it becomes old, the check and balance of abnormal cells, the check and balance system goes down, and so if you live up to 90 years, most probably 1 in 4 person will have cancer. But there are always some preventable causes and some non-preventable causes. Like 5% of the cancers are related to gene, but we cannot really change our gene, can we? Secondly, there are things like environmental pollution, and these are in the domain of government. But there are certain things we can change, we can check. So tobacco and alcohol are two preventable causes of cancer. So many of patients actually ask me, Doctor साहब, मैंने तो कभी इन्होंने 3 चीज़, मैं स्मोकिंग नहीं किया, अल्कोहल नहीं किया, नॉन-वेज नहीं खाया, फिर भी कैंसर हो गया. I don't know how come that non-veg always gets into it anyway. So the thing is that I always tell that I studied at All India Institute of Medical Science. So between All India Institute of Medical Science and Safdarjung Hospital, they are one of the busiest roads. Aravind Marg comes. मैं उनको बोला, आप रोड क्रॉस करते हो? सामने ओवरब्रिज है, उससे चढ़ते हो? नहीं सर, वैसे ही. So thousands of people crossing the road every day. So that, and only few people takes the overbridge. The chance of getting run over when they were crossing road without waiting for the red light is much higher. But few people, in some day for a bad luck, the overbridge get collapsed and a person who is using the overbridge can also get killed. But what is the chance of getting killed? Running through the road or taking the overbridge? So it is not that tobacco is the only cause or alcohol is the only cause. But these are two preventable causes. And please, whatever the tobacco industry says, or recently WHO has come out with that, there is nothing about the healthy dose of alcohol. So tobacco and alcohol, if separately and together, can cause a local inflammations, ultimately leading to cancers. It may not take 1 day, 2 days. As you said, the incidence of Western world has come down because in the lung cancer, because the male stopped smoking, say 50 years back. But the cancer will, when you stop smoking, the cancer will develop a decade or 2 decades after that. So it's not that today you stop smoking and after 10 years, if you have cancer, you say, I stopped smoking 10 years back. So it's not like that. The cancer takes a stage. So it's starting from metaplasia, dysplasia, carcinoma in situ, and then invasive cancers. So tobacco, again I will reiterate, tobacco and alcohol separately damages many of the tissues. They are responsible for multiple sites cancer coming from the oral cavity, lung, urinary bladder, stomach. Alcohol can also cause cancer of the esophagus, stomach, and the GI part, and together they are complementary and supplementary to each other. So if you are doing it, I cannot prove it. It's a free society. First, do that on your own risk.
Right. Talk us to Dr. Panda said that, it is the preventable causes are alcohol and tobacco, but what are the other factors like pollution he mentioned? And, I was speaking with Dr. Guleria outside and he said, we've had, in this past year, we have had 70% of days which were, the pollution was high in those above the normal level. So, and that study which I was referring to, that clearly said, that pollution could be a major cause for lung cancer going forward. What are your views on that?
So, adding on to what has been said by my esteemed panelist, I would like to add on here that if we see about all the causes of cancers in men, I think tobacco and alcohol, they top most the list. But apart from that, there are some other causes as well, like genetic makeup. And of course, there are pollutants which can be indoor pollutants and which can be outdoor pollutants as well. So air pollution definitely is a risk factor. And apart from that, indoor pollutants like for lung cancer, if I talk about, then radon gas is something which is considered to be a risk factor. And people who live in basements and they don't open their basements, the radon gets accumulated. So in US and all, they do check the radon levels as well. And then there are so many infective causes for cancers in men. Like if I talk about oral cancers, earlier only tobacco and alcohol used to be the cause for oral cancers, but now there's another infection which is human papilloma virus, and for which we have a vaccine which is mainly given for females for cervical cancer and now also for men. So HPV now is emerging as a very big factor for oral cancers in both men and women. And apart from that, there is something, the area behind the nose which is known as nasopharynx. So there is Epstein-Barr virus, which is considered to be a risk factor for nasopharyngeal cancers. For stomach cancers, there is something which is known as Helicobacter pylori. So these are certain infectious agents also which are responsible. So, and so as you said about pollution, so definitely as he said that there are modifiable factors which are under our control and there are certain factors which are not under our control. So air pollution is something which is practically not possible for us to do, but carpooling, I mean, of course we are not going to discuss those factors, but these are the factors which are not under our control. Individually we'll have to take into account, but suicide stick, that is a tobacco, I normally call it suicide stick, I don't call it smoke, bidi or cigarette. And there are these suicide masalas, pan, gutka, keni. Like recently I was in a marriage, a very big marriage in the ambience island only. And there was a very big counter where apart from serving those chaat, matlab chatpati goliyan, there were pan being served with shekhar and shikhar or ye sari cheezein. And that was a very affluent wedding, you know. So this is what is happening. We can avoid those things. They are under our control. So at least let's have a control on the modifiable factors. So that at least, that's our bit. So we have to decide whether we want to have a share of cancer in our life or can we do something to prevent it?
I just wanted to say one thing. See, air pollution is something, as a society, we can change. Please try to understand. I'm not actually from Delhi. For the last I came here as a student and ultimately stayed.
That's a good thing.
For 2 decades, I'm staying here and I've seen that what are we living for? I have a 9-year-old daughter and a 15-year-old son, and every day they go into a school bus. I'm thinking what they are inhaling. I mean, we may have a bigger car, even bigger house, and we are running a rat race for that. Does it worth it if you do not have free, clean water, fresh air? I'm no socialist, no communist. I live in a capitalist society. But please try to understand what is worth living for. If you are not every year, if few days are coming, and cancer is not the only one. You see a COPD patient, emphysema patient, the life becomes so miserable for them.
I think doctors are in a safe zone. We don't judge their political ideology. You can still say, because even politicians can't question you because at the end you treat them.
This is a very, air pollution and water pollution is very, very democratic. It will take everybody from the top guy unless and until he sealed himself in a oxygen cylinder. So it's a very democratically way of getting the poison.
Right.
So,
Coming back to oral and lung cancer, Dr. Chaturvedi, are there early signs and symptoms that one can note? Obviously, when the oral cancer develops, it gets very, they come at the later stage. But what are, we were talking about the prevention, so what are the early signs and symptoms that one can note for oral, are there any for lung cancers also?
So I think this is very important because as we were all talking about, few cancers are preventable, and for that tobacco, alcohol, obesity, weight loss, increased fat consumption, that is important. Vaccinations are very helpful today for prevention. Few are screenable. For screenable cancers, we talk about breast cancer, cervical cancer, prostate cancer, and in that reference, I will use the word for lung cancer, because in smokers, low-dose CT is now of value to detect cancer early. So wherever screenable cancer is there you can actually go for a regular program depending on the site for which you are screening. For lung cancer, if you are a smoker, then it is wiser to have a low-dose CT scan after the age of 40, after having had 20 pack years of smoking, and that will help in detecting early cancer. Now, if you're not screenable cancer, and this applies for every cancer, from oral cancer to any cancer, any symptom, any ulcer, any lump, any nodule, any lymph node, any cough, change in voice, hemoptysis, any episode which persists beyond 3 weeks or which has a recurrent episodes happening, frequently it's happening, then cancer should be ruled out. So when you apply this theory in oral cancer, oral screening for early detection of oral cancer, any ulcer in the oral cavity, so normal aphthous ulcer, benign ulcer, they will heal on their own in 2 to 3 weeks time. If it is persisting beyond 3 weeks, please go to a doctor and ask specifically that I want to rule out cancer. If you apply the same thing for lung, any cough more than 3 weeks, unfortunately smokers are the ones who get cancer, and there's something called smoker's cough. They get used to their cough and they accept that the cough is part of my smoking habit. But any cough which is there persisting for 3 weeks, it should be checked by a physician, to rule out cancer. Any change in voice or any loss of any symptom which is not routine, one should rule out in 3 to 4 weeks time.
Right. So a CT scan for the lung cancer.
Low-dose CT as screening. That is for screening and early detection.
And mouth ulcers for the oral cancer. Right. Coming to stomach cancer, it is also specifically high in prevalence in men. Dr. Sharma, why do you think that is? And are there any early symptoms for stomach cancer? Because it is, I'm talking about the Globocon the data which came out in 2020, and its stomach cancer was right there on number 3rd.
Yeah, the incidence of stomach cancer is also higher as compared to the female patients, and it's all depends upon that 2 factors. One is that demographic factors, and second is the geometrical factors and ethnicity also. So if you see, the incidence of stomach cancer is very high in northeast region as compared to the all over India. And these all depends upon their cultural practices and their lifestyles also. Incidence of stomach cancer, if you see worldwide, is very high in case of in Japan and Korea also. So it has been seen that those patients who are the natives of Japan and Korea, and if they migrate to the low incident area, so their incidence of developing stomach cancer also decreases. So it all depends upon the geographical changes and their environmental changes also. So if coming to that, the causes for stomach cancer, the 2 factors very important. Increasing the age, as already Dr. Rana established that. One is that H. pylori infection, as Dr. Indu Aggarwal already mentioned about this. This is the infectious, one bacteria which gets infected in that mucosa of the stomach, and it causes the chronic irritation, and because of that there is a chronic gastritis, and that develops into the cancer. So this is a type of infection when patient usually have कि मेरे को गैस है, पेट में दर्द हो रहा है, and at that time if they confirm that the patient has a H. pylori infection, which can be eradicated with the 15 days of treatment of some antibiotic and other treatments. So you can avoid that, and you can detect if you have a chronic gastritis, so you can detect early also. The symptoms, like I told you, that upper burning sensation, patient has itching, patient has excessive gas formation. So these are the early pain in also sometimes vomiting, nausea. These are the early symptoms of stomach cancer where you can. Doing upper GI endoscopy, that is visualization of the upper part of that our stomach and esophagus with the help of some endoscopes. So that can help in detecting early, in the early stages of that stomach cancer.
When the symptoms persist for a longer period.
Yes.
Right.
If I may just add two things, what Dr. J.B. Sharma has said is absolutely right. The incidence of stomach cancer in India is highest in North. In fact, Mizoram in particular. Of course, Mizoram is a very small state, but even that state has two population-based cancer registry, one only for the district of Aizawl. And secondly, you are right that the incidence of stomach cancer is higher in men. It's about 2.3:1 in India. If you want to read, there is a very nice medical article written by my teacher, Professor Atul Sharma, who is presently the head of oncology, medical oncology at AIIMS, and my dear friend Venkatraman Radhakrishnan, who is heading the ADR Cancer Center. It's freely available on net in IJMPO. So one of the reasons, speculatedly, is that estrogen may have some protective role in preventing. Now, Helicobacter pylori has been made a culprit, but please understand, only Helicobacter pylori most probably is not, because there are, if Helicobacter pylori would have been the only cause, then it is more common in low-income country like India, Pakistan, and South Asia, but the incidence of cancer is not the highest, stomach cancer is not the highest. So there must be other reasons. One of the important preventable reason is the food additives. In Japan, why it was high? Because Japan is a mainly fish-eating country. I'm a Bengali, I eat fish, but when you go to Japan and Norway, you will find people eat fish like anything. So to prevent the fish from rotting, they use high salt. And that and nitrosamine content has been postulated to cause these changes. So as we are eating more and more additive, we are buying food from supermarket, please understand with that you are also adding a little bit of additive in your body, and nobody knows what has happened 20 years after. So I may run a little philosophical, but I think we are like in Mahabharata Jaduvamsh, they ultimately killed themselves. So we are sort of.
I mean, surely this can replicate from northeast to
Northeast might be, there might be some genetic predisposition also, because Chinese populations, the Tibetan populations also have a relatively higher prevalence of upper aerodigestive cancer. So there might be some genetic predisposition, but we do not have the clear idea.
Right. Dr. Indu, tell me, do you think overall mortality in men is higher than women? And if yes, why do you think that is?
So that's a very interesting question. So the data shows that men develop more cancer and the mortality is also higher. So there are few reasons for it which come to my mind. One is that more men smoke. So the causative agents which cause cancer, they are all the more prevalent in men, like tobacco, alcohol. And I think they're also more exposed to all the occupational hazards. If we say like more people work in paint industries or in other industries, asbestos. So occupational hazards are also more, and the pollution also. They are more affected to pollutants, although in fact now the risk in women is also increasing because more women have started consuming tobacco and alcohol, and tobacco alone is responsible for 16 cancer sites in the body, and alcohol causes cancer of 7 sites in the body, and they're also like working more. Apart from that, it has been seen that women are somehow more genetically predisposed to have less risk of death with cancer because of some protective gene. And it has not yet been proven what is that gene, but they have some inherited less risk of dying from cancer. So maybe they are a little more privileged in that sense. So that's also one of the reasons. like similarly, like in COVID also, in one of the studies, they said that women, they have less risk of dying from COVID as compared to men. So I think this is one of the reasons. And also one more reason is that for like cervical cancer, for which is responsible for more of deaths in India, we have something to prevent it. It's the most easily detectable, preventable cause of death, and we have been able to reduce the risk of cervical cancer. Breast cancer is more easily diagnosed. So like for males, lung cancer is the most common cause, or lip and oral cavity and stomach cancer. So these are, for that matter, alcohol-induced liver cancer incidence is also going up, and these cancers somehow have a more increased risk of mortality as compared to breast and cervical cancers, which can be detected in a pre-cancerous stage. Like we can detect breast cancer even in a DCIS stage, which is stage 0. So that is also one of the reasons why men are more at risk of dying from cancer as compared to women.
Right. Dr. Panda, Dr. Chaturvedi said that prostate cancer, comes lower in the prominence, and I agree.
So I must say, what you asked for testicular cancer, and he is absolutely right. The testicular cancer incidence in India is 2 per 100,000, so it will not come in the top 10. But so what sir meant to say is that for a civil society group, a group for that, most probably where prevention is the bigger key, it may not merit a top discussion. But testicular cancer, medical oncologists are very, very interested. When I was teaching, we thought there are 2 diseases, Hodgkin's disease and testicular cancer, where no mistakes is allowed because they are 90% cure rate. So testicular cancer usually happen in, the second decades, and it comes with a swelling in the testis, generally detected by some surgeons or some physicians, and usually patient comes with a history of trauma, which is basically they become aware with post-trauma. But having said that, the good thing is that if treated properly, it is at a very, very high cure rate.
May I add on to this? So one message that I want to give to the audience here is that all of us, we keep on talking and teaching women about breast cancer, but tell me honestly, do we teach our sons to do testicular examinations? So ideally we say that every woman about 20 years of age should do a monthly breast self-examination, but we never teach men to do a testicular examination or to go to a doctor if they develop any lump in there. Like for breast cancer, there was a lot of discussion in the previous panel, but we did not emphasize the importance of a painless lump. We did not talk about that you don't have to go to a doctor only if it is painful. So even a painless lump, or I would say that the painless lump in the breast I'm more worried about. So similarly for testicular cancer, we should educate both men, young boys, to not to ignore any symptoms, not to shy away, not to get embarrassed, and not to report to a doctor. So, and similarly for prostate cancer, it is one of those, it's so easily detectable. A simple blood test, 300, 400 rupees test, simple blood test, PSA, prostate specific antigen, can detect cancer very easily. Tell me which cancer you can detect with a simple blood test. And in spite of that, most of the people, I don't know how many people in the audience, I would like a raise of hands, how many people, how many men have got their PSA testing done just for a screening. So here we are sitting with a very elite audience, but I can see only 3 or 4 hands being raised. And
one of them is a doctor.
Yes. Yes, one in the panel also. So what I mean to say is that these are things which can be very easily detected, and if you can detect it at an early stage, लोग ये कहते हैं ना कि टेस्ट कराया निकल गया तो निकलना तो तब भी है, even if you don't get the test done. But if it is detected before time, one is it might be detected in a stage 0 or in a stage 1 when it would be curable. You will need less of treatments. The cost of treatment would be less. The chances of relapse would be less, and the chances of leading an absolutely healthy life would also be more, and you can always lead a perfect life. So I think एक बात जो मैं और यहाँ कहना चाहूँगी, that is, we all talk about cancer, but I think the more important message the society needs is that cancer is not such a bad disease. It's bad because it is detected late. So we should talk more about the stories of people who have been cured and who have achieved their dreams, who are still, they have ticked most of the things in their bucket list. So हमें जो कैंसर के अवेयरनेस फैलानी है, वो हमें सिर्फ कैंसर के सिम्टम्स, मॉर्टैलिटी के बजाय वी हैव टू शिफ्ट द फोकस towards how many people are living normal life in spite of having cancer.
Right. Dr. Panda, so coming to the prevention part of it, and tell us what is the risk population for this, or what?
Prostate, you mean prostate cancer?
Yeah, both.
So as I said, the prostate cancer approximate incidence is about 9.3 in 100,000 population if the last Globocan 2020 is concerned. But there is some, see, prostate is a very dicey, why I'm telling you, that prostate is a sort of a not notifiable disease, and so actual incidence of prostate cancer are most probably much higher than what is it reported. But the problem is that there has been a lot of controversy that if you detect prostate cancer early or intervene early, does it change your mortality? Because many of the prostate cancer can be low grade. In fact, they have done, in textbook I've seen people in hospital where a regular autopsy post-mortality is done. In people ages 80 or more, maybe 1 in 4 or 5%, you will find some prostate cancer in their prostate. So there is something which statistically called lead time bias, where you detect something early, you intervene early, but you not actually, it seems that you have been able to increase the survival, but anyway the person would have survived. So that, but I agree with Dr. Indu that it is not a bad idea to do a PSA screening because it is cheap. So problem with cancer screening, why in male lot of cancer screening is not there? Because the basic epidemiological criteria for a screening of cancer is it should be cheap, it should be highly sensitive, it should be highly specific. There are definitions what is sensitivity, what is specificity. It is widely available, and because it's a public intervention, the government need to spend money. So it should be cost effective. Low dose CT has now become cost effective because of the wide availability of CT scan. Otherwise CT used to be quite an expensive procedure. So as a screening a decade back also we could not have thought. Simply cervical cancer screening is easy because a visual acetic acid test or a pap smear, it is relatively cheap, more widely available. In fact, VA smear, which the Tata Memorial has popularized, it is even cheaper than a pap smear. It is widely available, easily interpretable, and any intervention does that, make a huge difference. So when we talk about treatment, which is a tertiary part, it is always most expensive. When we're talking about the primary prevention, that is cheap, that is more effective, and as a policy we should put on focus on that. So as a society we must put a real premium on screening, and the government is already started doing non-communicable disease. And another reason why the cancer death is actually increasing, because we don't talk, we have been able to control mortality from a communicable disease. So the death from cholera, death from tuberculosis, those death from bacterial infection has actually come down. So that is an achievement. That's why we are surviving longer. At that 47-hour median survival was 35 or 38. Now we are living up to 75. So we are aging. And
so the age you mentioned, it's around 80 years, you said, right?
Well, not yet 80. I mean, in prostate, yes, 80 to 90. As you grow, the chance of detecting cancer will grow.
So how often should one take that test? Or Dr. Sharma, if you could add and tell us which people are specifically at risk.
Yes. So the incidence of prostate cancer, as with other cancer, also increases as the age increases. So at what age we should start the screening? We have seen that the incidence of prostate cancer is very less below 50 years of the age. So generally the age at which we start the screening is PSA is 50 years. So 50 years onwards, every year PSA can be done to check whether there is any increase in the PSA level, or is it gradually increasing, or what is the rate of increasing. So you can assume at that, and in that amount of the PSA can detect, can advise that whether you should go for the biopsy or other test. So this is very early. So at the age of 50, you can start that PSA screening.
Once, twice a year? Or
Once a year.
Once a year, right. Dr. Chaturvedi, this is my last question since we're running out of time, and I want to understand where is the push needed in our healthcare sector from the government to reduce cancers in men? Also, is there a social stigma, or there a a concept of men that comes in a way, in terms of detection or their willingness to come out and?
So I think the incidence is as we are seeing, there's a trend and we are seeing more and more people affected by cancer. The stigma is going down. So that I would say that people are today coming out, getting screen checked. As far as the government push is concerned, as we have been continuously emphasizing, there's a lot preventable, a lot we can screen and early detect and things like that. I think one is this widespread awareness and all. But I think there's a gap. Presently what we have are big hospitals which are treating cancer, or there are setups which do not have adequate diagnostic facilities. So I believe that today there's a space where we need diagnostic centers which are government sponsored, which have proper sophisticated diagnostic centers. In that space, largely private sector thrives. There's no structured government structure. And the moment you put these big centers into the hospital domain, the whole process gets more hospital driven and the cost goes up. So I think there's a big gap here lying between primary health centers and tertiary hospitals of creating setups where you can screen, detect early, and address the lifestyle disease collectively, in a collective manner, where I think the pickup will go up and the early detection will be reality.
Dr. Sharma,
I just wanted one point. This is very important. See, healthcare is too important thing to be left to private alone. See, the private healthcare works on efficiency. What is efficiency? One person does the work for 3 persons and get paid a little higher, maybe for a 1.5 persons. Then everybody makes profit. But for a public healthcare, this cannot be the only model. Ultimately, if you have to reach the last mile, last person, I think for a benevolent state, healthcare and education are the two things where a state cannot withdraw their hand and leave it to private healthcare. Because the bigger profit which comes is intangible, which is seen after maybe 2 decades, 3 decades. So I think primary healthcare, including epidemiology, screening, the government need to put money, because the benefit we get is, I would say in Hindi, amulya. It is priceless. It cannot be measured tangibly by few million, billion, or $1 trillion.
Sure.
Yeah, as Dr. Chaturvedi has pointed out, that awareness, that is very important. Diagnostic, early detection, awareness, and 3 is the prevention. So we should aware the people about that incidence of cancer and related factors. For example, tobacco-related cancer, we should highlight that it causes that. Tobacco, though it is already there on the packet, it has been. So we should aware the people about young generation from the colleges and all that people where they initially start up with the smoking and use of tobacco. There we should highlight, there should be some government programs in the schools to aware that people about the incidence of cancer increasing. Early detection with the opening of diagnostic centers where we can use that screening techniques, and prevention. So those patients, those who get this and the cancer, how to prevent that further cancer also, second cancer in the body, and that some other preventable medicines where patients or relatives who are high risk for the developing of cancer.
Definitely I agree that there a lot needs to be done on the front of cancer, and somehow cardiovascular diseases and cancers, they are the most leading cause of death, and they have all the factors in common. Most of the factors are common, like smoking, alcohol, obesity, not exercising, not eating proper food, vegetables, not getting your checkups done. So governments and private institutions, they of course have to do a lot in this sphere. But at the same time, I think it's our responsibility as an individual to be responsible for our own health. We have to be the captain of the wheel, captain of the ship. See, there are, everyone knows that tobacco causes cancer. Everyone knows that alcohol is a risk factor. And in every hospital, whether government or private, the facility for cancer screening is available. but how many people actually go for checkups? So till we as an individual take the responsibility of our own health and start going for checkups, as many number of facilities you might create, as many awareness you might create, nothing is going to change much. So like we can detect breast cancer all by ourselves, but then why do women come with a 5-centimeter lump or with a fungating mass? So I think it's important that we worship our body, we respect it as a temple, and we go for our own checkups and not leave it कि मेरी wife मुझे checkup के लिए लेके जाएगी या मेरा husband मुझे लेके जाएगा तो ही मैं checkups के लिए जाऊँगा. If I can go for shopping alone, if I can go for anything else, then why can't we go for our own checkups and take the health as our own responsibility?
Right.
That's what I would like to add.
Thank you. As part of worshipping our health, I think there are age groups here which can take a lesson from this discussion and actually go out and take these screening tests. And right. So thank you so much for listening to this conversation. Thank you, panelists, for joining us here and enlightening us on cancers on men. Thank you so much, everyone.